Physical activity is one of the few modifiable determinants of cancer risk. It's been estimated that approximately 1/3 of all cancer deaths in the U.S. can be attributed to dietary and physical activity habits, including obesity. So if we can reduce sedentary behaviors and promote physical activity, there's a real opportunity to greatly reduce the cancer burden in the U.S. The Duncan Family Institute has provided me with this unique fellowship, the Mentor Junior Faculty Fellowship in Cancer Prevention. So my research, focusing on Mexican American adolescents, is trying to identify factors at multiple levels in terms of the individual level, interpersonal level, and as well as environmental level that might be associated with these behaviors. So I'm focused on Mexican Americans and adolescents in particular because this is an important stage in life in which you tend to see excess weight gain and also sort of a precipitous decline in levels of physical activity, particularly in girls. And so given that behaviors that are adopted and practiced during adolescence often do track into adulthood, if we can find out the types of things that are associated with behaviors in adolescence and how to promote physical activity in adolescence, that can help to maintain these healthy behaviors over the life course. Not much research has actually looked at multi-level factors simultaneously, particularly in minority or underserved populations. And also this allows us to be able to determine the relative influence of factors at different levels, as well as the relationships among individual level factors as well as neighborhood level factors, which can provide insight as to the pathways through which neighborhood environments may influence behavior. The more that we understand how environments, including the social environment and the physical environment, how they influence important behaviors related to cancer, such as physical activity, the more that we understand these relationships, the better able we are to design effective interventions or programs to be able to address these factors to promote increased physical activity and reduce sedentary behaviors. In addition to influencing future research, the more that we understand about how the social and physical environment influence behaviors such as physical activity, it can inform not only future research, but also policy efforts and priorities around programming or funding or community design and things like that that can have a real impact on communities. I want to thank the Duncan family and the Duncan Family Institute for this unique fellowship that has really provided me with opportunities and the resources to be able to pursue my own research interests, focus on developing my own independent research program, and to be able to develop the skills and experience to apply for externally funded grants, for example through NIH, and just to allow me to become an independent researcher.